into this lesson, I want you to take a moment to notice how you're breathing, what your breathing pattern is like. Are you taking deep breaths? Are you taking shallow breaths? Take a moment to notice that. And then consciously deepen your breath, breathing into your belly, breathing in peace and relaxation, breathing out fear, worry, and tension. I want you to continue breathing like this for the entirety of this lesson. And then at the end, I'm going to ask you how you feel. So breathing, it is so incredibly important. It is one of the greatest gifts that you can give to your body during pregnancy, during childbirth, and after. With breath comes the deepest form of peace, calm, comfort that we can get from any other aspect of life. There's no pill that can make you feel as calm as deep, continuous breathing. And something that's so important to remember if you're having difficulty breathing deeply is to notice your posture. If you're hunched over and your neck is bent, it's probably going to be harder to breathe. So being conscious of your breath is also going to help your posture, which is greatly going to minimize any discomfort you feel in your body during pregnancy and childbirth. And guess what? Breathing also helps you stay fit and firm, because the deeper you breathe, the more your metabolism works. So after you have a big meal, if you want to keep that metabolism going, take deep breaths. And that's one of the best ways that you can lose all of that postpartum baby weight, is by continuously breathing deeper and deeper and deeper. So there's 3 main breathing techniques that I'm going to teach you throughout this lesson. The first is the Destressor Breath. This is the breath that we're going to use in between surges and throughout your pregnancy and in motherhood. This is just a general calming breath. And then we're going to learn wave or surge breathing. And this is the breathing that you're going to use when you're having your surges or your contractions. And then you're going to learn descent breathing. Remember when I talked about how you can breathe your baby down? This is the breathing that will help you do that. So first we're going to talk about the Destressor Breath. So the idea behind this is just taking in a deep, slow, conscious breath, maybe into the count of 6 or 8, just holding for a moment, and then breathing out to the same count. This is a very rhythmic breathing, and just allow it to take you deeper and deeper and deeper within yourself. And this is a really effective breath if you ever find yourself spiraling into that fear, tension, pain cycle. If you find yourself in the metaphorical emergency room, the de-stressor breath will help you move back into the healing room. And I encourage you to inhale through your nose and out through your nose. Because what can happen when we start breathing through our mouth is that we get panicked, especially during birth. This is when you can start to hyperventilate, but breathing in and out through your nostrils forces you to go slow with your breath. And so the next breath that we're going to practice is the wave breathing, the breathing that you're going to use when you start to have those surges. And the idea behind the wave breathing is that we're giving your uterus plenty of room to expand, which is what it's going to do naturally during your birth. Because what happens to your uterus when you start to have a surge is that the inner muscular layer of your uterus, it starts to contract if you're not breathing. It'll start to expand if you're breathing and giving it space. And then the outer vertical muscles of your uterus, what they do during a surge is they pull up, out, and down, up, out, and down. So your uterus really does expand and lift up as you're going through a surge. And so this wave breath gives your uterus plenty of space to expand, greatly minimizing the discomfort that many women experience during a surge. Because what happens when you're holding your breath because you're afraid of the surge is these vertical muscles, they keep pulling, but these inner muscles, they're fighting against it. And that tension, that fighting is what creates the discomfort. But when you're doing this wave breath and all muscular layers of your uterus can work together, your pain just flows away. So to do this, what I want you to do is place your hands on your lower abdomen. You can close your eyes. And imagine inflating a balloon out, 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 out. We don't want your chest to be coming up. We want your belly to go out, out, out. And this might feel a little bit unnatural at first. That's okay. As long as you practice it every day, say every morning when you wake up and every evening when you fall asleep, it'll become easier and more organic. And your body will naturally go into this breathing when you go into birth. So to begin with, just expand that balloon as far as you can, and you're going to be doing a very slow, powerful inhalation as the balloon expands out. And in the beginning, I want you to count, say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. And the idea is eventually I want you to be able to get all the way up to 20. But when you first start, you might only be able to reach 10 or 12. And then what I want you to do when you reach capacity, I want you to slowly exhale to the same count. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And continue this breath. As soon as that balloon is fully deflated, immediately begin inflating it again. And you might need to do mini wave breaths with every contraction, continuing to inflate fully the balloon in your belly and fully deflate it. And then when the surge subsides, go back into your Destressor breath, just slow and easy breathing. And the final type of breathing that you'll use is the birth breathing, the descent breathing. And so this is very similar to a yoga breath that you might have experienced in a yoga class. And you take a powerful inhalation and then you push the air down the back of your throat, down through your uterus, and down and out your vagina. It's making a J pattern, down and out your body, down and out your body. And this is a very, very important time to visualize your uterus opening, your cervix opening, and your baby going down and out, down and out. So practice the breath again with me. A strong inhalation, and pressing that air down, and you're going to make a sound in the back of your throat. And so this is a really great breath to practice when you're having a bowel movement. So instead of pushing and contracting, you're opening and expanding and pushing that fecal matter down with your breath instead of forcing it down. And doing this breath when you're having a bowel movement will also build your sense of knowingness that this breath can actually push your baby down. And you might, again, also use this with pushing with the traditional bearing down. But it can be nice if you're also doing some of this birth breathing to make sure that your body and your baby is getting plenty of oxygen during the pushing phase. Because as you're pushing the baby out, this can sometimes be the time that your own body or your baby's body goes into a bit of distress because it's not getting enough oxygen. So make that your mantra during the pushing phase, is that you're getting your baby and your body lots and lots of oxygen. Lots and lots of oxygen. And you can do that through the birth breath. So as a recap, you have your Destressor breath. Easy inhalation, easy exhalation through your nose whenever you're feeling stressed out in between surges. And then when you begin to have those contractions, those surges, you go into your wave breathing, fully inflating that balloon to a count of 0 to 20, and then slowly deflating it from a count to 20 to 0. And then when you feel ready to begin breathing or pushing your baby down, you can start practicing those birth breaths. And if these breathing techniques are all that you do during birth, you'll likely have a very beautiful, easier birthing experience. So you've learned all of the breathing techniques that you'll utilize for the rest of your pregnancy and specifically during your birth. They're going to make your birth so much easier. And now I want to check in. I want to see how you're feeling after tuning into your breath and empowering yourself to claim your breath, to claim how deeply you go. So take a moment now, close your eyes, and just settle into how you're feeling. How does your mind feel after breathing deeply for a few minutes? How does your spirit feel? And how does your body feel? I feel this really nice tingling sensation in my body, and I would like to feel that way all the time. So this is a really good reminder for me as well to always tune back into my breath at multiple times during the day, to tune in, to think, okay, how am I breathing? How am I feeling right now? And almost every time I'm lacking in energy, or I'm feeling like I just want to eat that whole thing of cookies, or I just want to lay on the couch and do nothing, if I tune back into my breathing and take a few deep breaths, I kind of lift out of that stagnation, out of that negative, lazy energy. So you can practice that as well, moving through your days.